So our topic for today is for the HSE to present upon their report, Understanding the Impact of Business-to-Business Health and Safety Rules. And as Dimple's already mentioned, I'm really pleased to welcome Jeremy Bevan and Richard Plant, who are both policy managers in the Blue Tape and Business Burdens team. And as we've said already, questions will be taken. Please utilise the question facility in the webinar. And at this point, I'd like to welcome Jeremy and Richard and hand over to you, and you will now take charge of the screen.
Thank you very much, Craig, for that introduction. And my name is Jeremy Bevan. I am going to be taking you through our presentation. And once I've completed that, my colleague Richard will be joining me to try to answer any questions you may have. Craig's already referred to the chatter around our report published in July, and my guess is that having had sight of the report, that's why many of you are listening in today. So we welcome the opportunity to both give you the background to the work, to describe to you some of the findings articulated in the report, and to talk to you about the continuing work that we're doing on this project, which is now into its third year. And in very broad terms, this is a project to investigate burdens that may arise in the health and safety system from the impacts of health and safety rules. And I will come on in a moment to say exactly what we mean by that term. But first of all, I want to just give you some of the background to why we started this project at the beginning of 2017. As I'm sure you're aware, surveys, both from government and other organisations, are constantly taking the temperature of businesses for very good reason. Businesses exist to make things, to provide a service, to create employment, to make a profit, hopefully. No business performs at its best when it's stressed by what it has to do to comply with health and safety obligations, whatever the source of those obligations may be. So we follow these surveys closely for some very good reasons. We know that bad health and safety can break a business, especially a small or micro business. Equally, good and proportionate health and safety can lay the foundations for good business practice. And these surveys give us some sort of proxy for whether businesses are engaged with health and safety and engaged with it effectively. And what the surveys, two examples of which we've got on the screen here, tell us is that businesses continue to worry about health and safety regulation, a term incidentally that they don't tend to define more closely. And that worry is likely to detract from them tackling health and safety effectively. The fear of getting it wrong, of being sued by an employee or a member of the public who may have been injured by a work activity, keeps owners awake at night. And scare stories, to an extent, the persistent media health and safety myths keep this worry going too. And for us, the real point of departure for this work is that all of this anxiety persists despite a decade, near enough, of close attention from successive governments, starting with the coalition government in 2010, to ensuring that HSE doesn't regulate with too heavy a hand. And we've done a lot of work, as many of you I'm sure will know, to remove unnecessary, duplicating regulation and duplicating guidance over a number of years now, and that's a process that's continuing. But somehow the dial, as these surveys indicate, hasn't really shifted on perceptions of health and safety burdens. And it's interesting that the regular business perception surveys from the Department for Business don't really show any significant change in the percentage of businesses that say that health and safety law is burdensome. It's remaining stubbornly in the mid-50s% and has done so for a number of years now. So we, having been the subject of government focus for some time, decided that perhaps we needed to shift our focus to look at what businesses and business intermediary organisations are doing in the name of health and safety. And our broad research hypothesis, our starting point on this, was about possible burdens from excessive duty holder action on health and safety and or ineffective duty holder action. And those two things overlap, but they're not the same. In response to what another business, for example, a customer in a supply chain, requires or imposes of them. And it's fair to say that these concerns don't arise from nowhere. I think they've been around since the time of Lord Young's report, Common Sense, Common Safety, and the scrutiny that Professor Ragnar Löfstedt applied to HSE's activities several years ago now. And there is, as I've already referred to, still a significant amount of system noise, if we can call it that, that is, we think, a persistent source of possible problems in this area. So we're attempting to answer, if you like, a question that we asked ourselves: why has the dial not shifted after all the work that we've done in this area? And for us, health and safety rules cover 5 main areas. In supply chain and procurement, tendering requirements on health and safety through conformity assessment schemes, such as safety schemes in procurement and similar things. The use of health and safety system standards like now ISO 45001, replacing of course BS OSAS 18001, system standards akin to and increasingly following the same sort of template as ISO 9001 for quality and ISO 14001 on environmental systems management. So that's a second area. The third area, use of third-party advice, the advice that consultants, trade associations and so on give. And I suspect that will be a key area of interest for many of you today. Fourthly and fifthly, quite closely related, effects from the civil law regime. So what happens when an employee or a member of the public decides to make a claim for injury or ill health caused by a work accident, and the related impacts from insurers' role in that system and their response to claims. I think it's very important for us to say that we are not talking here about a world of charlatans. We have not approached this work with a view that all of these bodies that impose rules are out to get one over on duty holders. For the most part, it's a matter of people trying to help, but for a variety of reasons, not always getting it right. And we should say right at the start, in the interests of balance and clarity here, that on the whole, the system of health and safety rules applied through these 5 areas we think is working well. It's also important for us to be clear that our work here is not about blocking the market. There is undeniably and quite rightly a market for health and safety services. It's not our regulatory role, and we don't actually have the power to intervene in that market. And we're not about stopping people going beyond compliance if that's their informed choice. And finally, I think going back to some of the work that we did under the Red Tape Challenge and in response to reports from Lord Young and Professor Löfstedt, it's important also to be clear that this is not a further round of deregulation. We will not be getting rid of regulations as a result of this piece of work or in response to the report that we've published. So, as I've already said, our overall conclusion is that the rules generally are working well, and they are serving a purpose. They are helping duty holders out there to comply with the law. We undertook a number of large-scale pieces of research to get the views of business about how the rules are working. A piece of behavioural insight research interviewing 1,400 businesses across a range of sectors. A very large-scale survey through YouGov with 2,000 businesses asking them for their perceptions of the rules. Some focus groups with regulatory inspectors, both HSE and local authority, and a lot of desktop analysis of research from other organisations on this topic. Richard and I think that between us we have reviewed about 80 pieces of work, published probably over the last 7 or 8 years, but the majority of them in the last 3 or 4. And so the findings then, a significant proportion of small and micro businesses report a big burden, and different surveys come up with different figures. In our work, we think that this is about 30% of businesses. Now, how many is 30%? In the UK as a whole, there are thought to be about 5.7 million businesses, so it's 30% of that figure. There's another figure that circulates which says that there are approximately 3 million active businesses. So I think whether you take the higher or the lower figure there, you can appreciate that 30% of businesses feeling a burden from health and safety is a significant number in absolute terms. I want to focus on 2 particular findings from the research, and these are the lower 2 bullets on this slide. So 39% of businesses reporting to us through these various pieces of work that I've mentioned that their policies and practices feel excessive and disproportionate in relation to the risks of their business. And 35% of them feeling that there's no real link between what they're required to do for health and safety and what they actually do to keep people safe at work. And again, in the interest of perspective here, you can of course flip that figure around the other way and say that, so actually in 65% of workplaces, the 2 worlds of what people are required to do and what they actually do are properly aligned. But as far as we're concerned, problems worthy of further investigation come when those 2 worlds are not properly aligned. So I'm going to get a little bit more now into the detail of that. And this slide really gives an overview of where some of the effects and impacts are being felt most keenly. So the row descriptors down the side in grey are by type of impact. Now there are 11 there. 2 of those, the first one, health and safety legislation, and the third one, possible action being taken against me or my business by HSE, can properly be laid at the door of government and health and safety regulators. But all of the other 9 are impacts that arise from health and safety rules. The column descriptors across the top in the what I'm calling mustard colour show the range of sectors that we talked to get their views on these impacts, and you can see a scale there at the right hand side and some perhaps surprising impacts. In education, for example, 67% of respondents saying that it's the health and safety requirements of our clients that are causing a significant impact. And the narrative that goes with that sense of impact was very interesting to us. Threw up the point that a key underlying driver is the fear of civil litigation. It's a large and systemic driver of what businesses do to try and stay on top of health and safety, and it's pervasive across the system. And the other is that all the 9 non-governmental factors in the grey down the side there combine to create overall a bigger impact than anything HSE or local authority enforcers could. And so they can make legislation seem somewhat beside the point, because after all, your customers or your clients, the people whose tender lists you're trying to get on, if you're a small business, are on your doorstep every day. So I'm coming on now to talk about some of the findings in relation to specific areas, these 5 pillars, if you like, of the system of rules that I described earlier. And talking first of all about accreditation or conformity assessment scheme impacts. So we're firmly here in the territory of the supply chain. And the headline scores here, about 40% of businesses saying that these have some impact, and they have a big impact for 20% of businesses. As I'm sure many of you will know, these schemes are an idea that started out in construction as a way of being able to demonstrate that you have, as a supplier, organizational competence on health and safety. They were a specific requirement of the Construction Design and Management Regulations 2007. But what we've seen over time is that they've spread to other sectors. So we heard, for example, from a health and safety consultant who told us of a stationery supplier that he advises. This firm supplies stationery to local authorities, and the local authority, one particular local authority, was applying the health and safety elements of safety schemes in procurement to that stationery supplier. And we wondered why. Of course, local authorities need and want to practice due diligence, but we would say that needs to be done proportionately, not as a blanket thing. So we've heard, for example, that local authorities want to assure themselves, quite rightly, that a duty holder has processes in place for identifying and preventing modern slavery. That's very important. It's a very key issue at the moment, very live issue. But why use all of the safety schemes in procurement, health and safety questions as part of a package that's attempting to do that? So choose your focus, be a bit more discriminating. The other thing that businesses have told us about is that they're often required to accredit to multiple schemes. So clients or contractors often have a preferred scheme, and they then oblige the supplier to subscribe to that, even if they're already accredited to a different scheme. And the health and safety content of the question sets for different schemes, certainly within safety schemes in procurement, is identical. So there's arguably no further value in going through the processes for a second, a third, a fourth scheme, and so on. And we heard, for example, from a solar panel supplier who told us that they accredited to 5 or 6 different schemes just to satisfy customers and clients, and they reckoned that cost them something like £15,000 a year. And you can see here in the blue at the bottom of this slide the views of businesses on the receiving end of these schemes, feeling that there was no value in signing up to any number of schemes, apart from allowing you to get onto tender lists to tender with large customers and contractors. Moving on now to management systems and the certification and impacts that go with that. And this is quite a busy slide, but again, I think there are some some key findings in that first bullet point. So 14% of businesses, and the numbers rise for larger small businesses, reporting a big impact, 40% reporting some impact. And I think standards will probably be familiar territory for many of you listening today, but just in case not, the genealogy of standards like ISO 45001 goes back a long way. It's about taking a systematic approach to managing health and safety. They can be valuable. And of course, legislation like the Management of Health and Safety at Work regulations expects a structured approach to how you manage health and safety. But what we found from engagement with both British Standards Institution and ISO is that 45001 and other management system standards like 9001 take a very structured approach geared to evidencing processes and systems that larger or more complex businesses are likely to recognize and be comfortable with. But we have our doubts as to whether they're always appropriate for smaller and simpler businesses. And I think the figures here suggest there is some stress in the system that might suggest that they're not always applied appropriately. And we think there are a number of factors at work here. ISO 45001 claims in its introduction to be suitable for businesses of all sizes. At a launch event for this last year, we heard the claim that it would be suitable even for your local scout troop. I think many local scout troops would probably run a mile when faced with having to implement this. Standards like 45001, we have direct experience, are written by staff from the standards bodies themselves, of course. The committees that write them are populated by auditors and consultants by and large. It is quite difficult to get small and even more difficult to get micro businesses involved in the drafting process because it's a time commitment and often drawn out over months or years. And that's why guidance can be very lengthy and written in a very technical way that is not amenable to a small, time-poor business that may not have a great deal of expertise on health and safety, but may simply have been asked by a client or a customer to implement 45001 as a condition of doing business with that customer. And so, for example, when we started our involvement with the British Standards Committee that was drafting guidance on ISO 45001, now published as ISO 45002 in various parts, we had to whittle a document down from 100+ pages and growing to about 25, and do the same with the topic guides that were developed to sit underneath that. We're working at the moment with ISO on whittling down an implementation guide to the standard to about 50 pages from a starting ambition within ISO of about 220 pages. And small businesses are just not going to have the time or the inclination to read that sort of thing. Just purely in terms of design, the way standards are set out can be very text dense. There are not a lot of diagrams or illustrations. And because the small business voice is not easily heard during the drafting process, it's difficult for them to be able to say, no, this is too difficult for us. We don't understand that. Can you make it more simple, please? Until it's too late and the standard has been published. So businesses end up implementing standards like 45001 reluctantly. It feels like having something done to you. You're simply conforming to what others want, and at a cost, of course. And it's interesting that the Federation of Small Businesses produced a report last year that suggested complying with standards, not simply 45001, but standards as a whole, runs at a net cost to businesses, and their findings pretty well netted off against some findings a couple of years ago from some research done on behalf of the British Standards Institution that suggested benefits from standards. So they're not necessarily the solution for everybody. I mentioned right at the start the finding from our research that there is a pervasive impact from fear of civil litigation, and this slide shows you just how pervasive. So 74% of businesses saying that a lot of what they do around health and safety is to protect themselves from being held liable for accident or injury. And the effect of that is to lead to more and more paperwork to try and prove that the duty holder has addressed every risk, however unlikely. And that's the mindset, I think, that the words in blue at the bottom of the screen here expressed. And we wonder if there is a law of diminishing returns here as far as improvements to risk management are concerned. Wonder also what needs to be done to damp down this sense of fear, this sense of there always being something that could catch us out, the scary monster in the corner that keeps business owners awake at night, worrying that they haven't done enough and that they don't know when to stop. And it is interesting that this is a systemic driver as well. So we think that it can lead to larger contracting bodies imposing disproportionate requirements down the supply chain, just so that they are not exposed to unanticipated health and safety liabilities. And the way that the system works through the claims management companies and to an extent through insurers is that once a claim is lodged, any missing piece of paperwork from the what's called the pre-action protocol owned by the Ministry of Justice for injuries and illnesses at work leads to the case being settled. So we had an example where a field worker for a large farming organisation, 50 large farms covering 90,000 hectares, twisted his ankle whilst working in a field one day, and the underwriter for the insurer said, "Can you show us your written risk assessment for holes in fields, please?" And the company, quite fairly in our view, said, "Well, we haven't got a risk assessment for something that specific. We can show you what we do to manage the risks in fields." At which point the underwriter said, "Well, if we haven't got that particular piece of paper from the pre-action protocol list, we better settle." And we know that goes on a lot. We don't think it's very helpful. It's a commercial decision, of course. We understand that the insurer is wanting to limit the costs that it incurs here, but it's in our view continuing to drive the pervasive impacts from this aspect of health and safety rules. And the reality, as opposed to the perception, is that certainly if you look at the portal for civil claims, numbers are falling in recent years as a result of recent reforms to the system, and average claim settlement rates in money terms are not rising significantly, but it seems to be the few cases that do get to court with very large settlements that are driving and sustaining this fear. So on to looking at where advice from third parties fits in. And you will, I'm sure many of you, be familiar with HSE's strategy for the health and safety system, helping Great Britain work well. We see the consultancy and the third party advice industry, if I can call it that, as a very significant lever for helping businesses get an intelligent grasp of what a proportionate approach to health and safety looks like. That ambition in our strategy, of course, is supported by tools that we have to help small businesses manage their risks in a proportionate way. Health and safety made simple, for example, the health and safety toolbox, and a lot else besides. But we recognise advising a market that has some both very expert components and some very inexpert ones. There are businesses that don't feel they have the expertise to manage risks themselves, in preference to using an external source. There is, I think, a real issue for businesses from a range of the factors we've already described that leads them to worry and to be concerned that they always need to do more for health and safety, and they don't know when to stop. And I think that is where good health and safety consultancy comes in. I think not so good health and safety consultancy can ramp up the concern that those businesses are feeling. So when they read, for example, that there's a long list of things to think of, or there's a word for businesses that don't take health and safety seriously, liable, that's putting it in perhaps more scary terms than is helpful for some small businesses. And there is, of course, in a marketplace, a role for marketing, but we have as this work has progressed, begun to wonder whether there is a role for the consultancy profession to think harder about the way that it markets itself to businesses. And I'll come on to say a bit more about that shortly. So some of our findings in relation to third-party advice. And again, just for the sake of a proportion and perspective here, let me say that a lot of third-party advice is good. It's more than that. It's an essential part of the system. But experience from our inspectors in particular, and from the large-scale YouGov survey that we ran with businesses, showed some quite interesting results. So not all consultants by any means visit the site as part of the service they offer, and perhaps more critically, only 52% provide some sort of handover. So explain to the duty holder what he or she has to do with the report provided or the information provided to make it a living document within the business. But the way third-party advice, once the duty holder has secured that, seems to work is that the business feels that it's bulletproof. It's got a lucky charm. It's identified all its risks, and nothing is going to go wrong. And of course, not infrequently it does. Or an inspector calls and sees that there's a significant risk that has not been assessed by the third party, and that's when the duty holder starts to become more concerned about what it is they've been sold. So there's a question, I think, here, and my last bullet starts to delve into this. Should we expect businesses to develop in-house competence more than perhaps we have, or is it okay to keep them dependent on consultancy, for example, through multi-year contracts, which we know operate in some areas? And again, if that's a business's choice, that is absolutely fine. But we wonder whether there is a role for consultants to think about where they choose to add value. So, for example, rather than simply helping businesses with completing risk assessments, which after all is a fairly crowded market. We've got quite a bit of guidance on how to do that, including a lot of example risk assessments completed to a template, or whether you can add more value at a later stage in the process by saying a year on, for example, okay, so let's see how those assessments were working. Did they cover everything? Have you had any incidents that suggest you need to look at it again? And so on. And it's interesting that at an event I was at last week, we've had an insurer wanting to, in a sense, make themselves work harder, ask themselves some harder questions about the support they're providing to the farming sector. going beyond simply telling them about risk assessment and seeking to add value further down the line. Okay, so why does all of this work matter to us? Well, first of all, it is a question of scale and effectiveness. I've already given you some figures for total numbers of businesses. We also, all of us, of course, are aware that the numbers of deaths and injuries at work and ill health cases are at something of a plateau at the moment. So something needs to be done to both help with the business efficiency gains that can come from reducing that toll, and to deal with UK PLC's other big issue at the moment, which of course is productivity, because sick or injured workforce is not a productive workforce. So this is about focusing your efforts on the right bits of health and safety, not the stuff that is, if I can put it this way, just paperwork or doesn't enhance the protection of your workers. Some businesses report their consultancy spend as a burden and are concerned that they're not getting the value from it. So we emphasize that it should only be used when necessary. But again, for balance and perspective here, we see a consultancy and government partnership as key to continuing to improve standards for workers here. But concentrate on getting businesses up to speed on the changes that materially affect them, rather than bothering the worried well. And part of the reason for that is that in due course, if health and safety rules and regulations, so the stuff that government requires businesses to do, are blurred, are mingled together, that's going to continue to skew perceptions of regulatory burdens, and that may well create pressure to reduce the stock of regulation, because businesses may not distinguish clearly between the two to their elected representatives, and the first thing ministers will do when they have those sorts of calls on their time is come to us and say, right, HSE, what can you do to help here? So, taking action. First of all, we're clear. Our approach here is and continues to be about working with the market that's out there in all its forms, but encouraging it to do better where our research suggests that it needs to improve. So the chatter that Craig referred to earlier, some of the discussion we've seen on LinkedIn and elsewhere suggests that perhaps we haven't suggested the positive contribution that gatekeepers of health and safety rules can play. So for the avoidance of doubt, we are not about sweeping away any of these pillars of the rules that I've talked about. But we are about recognizing that with influence comes a responsibility to both recognize the weight of impact rules and those who apply them have on duty holders, and to do what can be done to make those impacts more proportionate. And so our future role here, I think, is very much going to be one of influencing more proportionate application of rules where we can. That's about conversations, including the one we're having today, with a whole range of stakeholders to ensure that risk management is more effective, that it does what people think and hope it's doing, rather than just being either neutral or in some cases even positively deleterious to management of health and safety on the shop floor. So just to run through some of the things we have been doing very quickly, because time is moving on and I want to leave time for questions. We have revised one piece of guidance and published 3 new ones that are helping duty holders navigate health and safety rules rather better. But I think it's important to see this as part of a bigger picture, which is the revision of HSE's website to make sure that it more closely reflects what real world small business users want. what they need, and how they navigate the information that they need. And user feedback has been central, with focus groups helping us to further refine drafts that we've produced here. And so overall, what we're trying to do here is to reassure businesses, first of all, that for smaller and lower risk businesses, health and safety needn't be expensive and time consuming. It's not an ever moving target. Reassuring businesses that following simple guidance should deliver legal compliance, and that on its own will be enough for them to have certainty about that. So they will know when they can stop, when they've done enough. And so as a consequence, that they can manage health and safety in-house and only need to seek expert advice if in-house competence isn't available. So for us, this has been about shortening guidance and using some very basic techniques. So making sure that you put the key information up front, not dumbing down, but aiming for a fairly low reading age, because this reflects how people skim read. And this is an example here just to show how clear and simple writing can be more effective. The second example being a rewrite of an arguably very complex first sentence. This is taken from guidance on gov.uk, not part of HSE's work, but from another government department. So very specifically in our area of health and safety rules, we published 3 pieces of guidance and revised 1. The first of these is about getting help with health and safety. That's an existing piece of guidance that we rewrote. So the second, third and fourth pieces here are new, and each in turn tackles one of these pillars of the rules system that I described earlier. And I'm now going to talk in a little bit more detail about the first 3 of these pieces of guidance. So first of all, getting help with health and safety. The key message up front here: you can do it yourself. And as I said, you're legally required in any case to appoint in-house rather than externally if you can. But if you don't do it yourself, some points to consider. And this is really about the duty holder becoming an intelligent customer. Is the third party that's going to advise you knowledgeable? Do they have some experience in your industry? What exactly is it that you want them to do? And critically, at the end, when they've done it, what is it you'll get from them? What sort of handover will you get in order to help you make that document live in your organization? So we do say in this guidance that yes, if you're large or complex or high risk, the help of various bodies outside is available to you. And we also point to the availability of some of those as professional sources of advice. So on using ISO 45001 in a proportionate way, we've been very careful here to say that management standards can be useful, but if you're a small business, and especially if you're being asked to adopt 45001 because a customer or client wants it, use it with caution. I should be clear here that we are not talking about product safety standards. So for horizontal injection molding machines or radial arm drills, for example, we are talking purely about this standard. It's not, of course, a legal requirement. And if you are a small or lower risk businesses, we arm you with, again, some questions you could ask those who are asking you to implement the standard. So can you use health and safety made simple, for example, to demonstrate that you've taken a proportionate approach, or HSG 65, managing for health and safety, if it comes to that. We've also been careful to remind all of the players in this particular part of the system about the need for a proportionate approach when it comes to certification against the standard and audit against it. It's no good taking a proportionate approach to introducing it in a small business if the auditor then comes in and turns over every last minute pebble looking for non-compliances to fail you on. So health and safety accreditation schemes, again, key messages here, not a legal requirement, but it is one way of meeting pre-qualification standards. It's not proof in itself, of course, that you are organisationally competent. Particularly in construction, you're going to supplement that with site checks as well. But again, as we said, with management standards, there are other routes to demonstrating compliance. There are simpler questions that could be asked about policies in place, accidents over the last 3 years, whether you have employer's liability insurance, and so on. There's a very important principle of mutual recognition between schemes here, which aims to keep the cost down so that you don't, as a small business, have to endlessly accredit to further schemes at the whim of a particular contractor. Use that principle, we are saying to large contracting organisations, to make this system work more proportionately for businesses. Okay, I'm almost there. Last couple of slides. So I said that we are continuing to work with key players in the system here, including across government, who all have a very significant role to play. And we're going to be working with those for some time to come now. Occupational Safety and Health Consultants Register will be a key one of those, and we are committed to working with OSHCA as it introduces reforms to the way it works and continuing to support it. We're going to be continuing to try and influence both ISO and British Standards Institution to make sure they focus properly on what small businesses need from standards, and with the likes of the UK Accreditation Service to ensure that auditing against standards is proportionate as well. Working across government as well with the likes of the Crown Commercial Service to ensure that what they ask for in terms of public sector procurement is proportionate. We are not dictating to the system here. We're about starting a discussion, attempting to provide the thought leadership that people expect and perhaps hope for from the regulator. If you and other system players are the tide here, we're asking, how can we together lift all boats to reduce the toll of accidents and ill health at work while keeping things in proportion for the smaller and micro businesses? One of the things that we are thinking about at this stage is whether we might make some sort of continuing professional development offer to the health and safety profession on what proportionate looks like. Although what's disproportionate may be easier to define than what's proportionate, that there may be merit in expanding examples into a short course, for example, perhaps with input from inspectors, to help practitioners think carefully about their approach when they're on the front line with businesses. We'd welcome your thoughts on that. What we're doing in this area is ever more relevant, I think, in an ever more uncertain world, politically and economically at the moment. I don't think you need me to say any more about that. And by sharing our findings today, we're hoping to encourage others to drive improvements that they could make. So let me say that if you're an organisation that provides advice through websites to businesses here, and you're listening in from the financial services sector, maybe think about encouraging small businesses to come to our website, for example, by linking to health and safety made simple, for example. That's just one way that businesses could then have a absolute clarity about doing what they need to do and no more to comply with legislation. I have talked for far too long and probably not left enough time for questions, but I'm going to hand back, I think, to Craig and Dimple now to host the next part of the session, and we will try and answer your questions.
Thank you very much, Jeremy. What I'll just do a very short summary, and then if there's a couple of key questions that you may have you've seen a pattern on that we might just be able to answer, and then as we said, we can answer the rest afterwards. But I think by doing this webinar today, it's shown us that if people providing advice and support give proportionate advice with processes in place for key issues, then that is a definite plus step forward. And taking on your point about in-house competence, I think we just need to think about what's in the best interest of the client. And sometimes you're quite right. It might be that they have that in-house support, and then when they need support, they get it, rather than a blanket aspect, really. But the best thing about this report, it started people talking, and the chatter is what it is. But also, I think any chatter is good if it makes a change. And if I just think about how it's good to talk, this webinar has come from a conversation with Hugh Jones, who's the Vice Chair of the Financial Services Group, and then this webinar's here today. So I think we all need to play a part, go forward and take this report and help make that change. So I'd like to thank you both for your support so far, and then just ask you, Jeremy or Richard, are there any instant questions you want to try and respond to?
Should we just take that?
Yes. Okay. So I think first of all we'll take the one from Philip Pointer at 12:38. So publication of the report mentioned forthcoming HSE guidance on navigating the rules. Has this been published? Yes. So this was the 4 pieces of advice that we referred to. So specifically on how to get help with health and safety. On proportionate application of standards like 45001, on maximising effective use of accreditation schemes, and making clear the implications of the civil and criminal law regimes respectively for our paperwork. All of those on our website. So we're then, I think, going to go on to question here. Again, from Philip, and I think we'll come back to Keith Lyle's question in a moment if we can. So further to last note, why is this information not made available free of charge on the HSE website? So I think it is.
So I think there are 2 things here. There's a training course that's on offer on the use of risk assessments, which HSE is advertising. I think they're around the country at the moment, and essentially what inspectors would require from business on the use of risk assessments. The content of that training material isn't available free online, as Philip asked, but there is extensive material through Health and Safety made simple to guide duty holders on the use of risk assessments.
There was a question which I can't see now, but I did want to answer, which is about the role of risk assessment in HSE enforcement action. Yes, it does play a part. I think it's important to perhaps give a little bit of the bigger picture on that. We are working at the moment to ensure that our guidance refocuses, if I can put it like that, on managing risks effectively, rather than simply on that first stage in the process is the risk assessment. Because obviously, as all of you will appreciate, if an assessment isn't actually living, doesn't actually get use in the business, it's worse than useless. Okay, so anonymous attendee, 1247. You say 30% of businesses in your research consider health and safety a burden, equating to over 3 million businesses. So I don't think that figure is quite accurate, but it is a large number of businesses. Does this mean that all of these businesses responded to your surveys or research, or does this figure then represent a smaller portion?
So I think just to say here, our surveys are samples, which Jeremy spoke to, Insight Research, I think 1,400 businesses, and then 2,000 for a YouGov survey, and then these were scaled up to say, okay, so what does 30% of those businesses look like at a UK SME scale? And that's how we've presented those figures. Okay.
So what have we got? We have got SSIP questionnaires. Paul Kenny at 12:54. SSIP questionnaires are designed on PAS 91. Yes, mutual recognition not strong enough. Agree. Often due to health and safety advisors not being bold enough to challenge customer requirements. Yes, we quite agree with that. That's why we specifically put the lines in the piece of guidance on using accreditation schemes effectively, that the mutual recognition system is there and exists for businesses to go back and challenge the larger contractors if they're being asked to accredit to yet another scheme. Okay, we're just scrolling down to see what else there is in the way of questions here.
So from Philip saying, would you agree that throughout the supply chain and the resultant paperwork is as much driven by criminal law and the approach adopted in HSE investigations? So it's an interesting one. This I think through a lot of what we might say more informed players in the health and safety system, the sentencing guidelines are sort of coming up the agenda. But actually, from a duty holder perspective, it's explicitly the civil law that appears to be the driver. Whether or not that changes over the time, it remains to be seen. But at the moment, it's still the fear of being sued, and that is the one that appears to be the strong systemic driver that is both playing into duty holder anxiety and practice on the ground, but also the one that is cascading through supply chains, as essentially nobody in the supply chain at any point wants to be the one found liable or at risk of being sued. So all I's dotted and T's crossed, I think.
Yes, I think I would add to that the sentencing guidelines have recently been reviewed by the Sentencing Council, and they appear to have been somewhat I'm taken aback is perhaps too strong, but somewhat surprised by the effect on the smallest businesses, and we understand doing some further work to find out why that is and what, if anything, they may need to do about it. So I think there is a recognition of the effect of the guidelines. Okay, so anonymous attendee at 103. Perhaps part of the issue with civil claims is that it is decided on the balance of probabilities, further adding to the fear that everything must be backed up by paperwork to avoid any holes, increasing therefore a movement away from sensible risk management and the increased perception that health and safety is a burden. Yes, there may be an element to that. I think our guidance on this is probably only one part of what needs to be a wider solution here. We mentioned in the presentation the reforms undertaken in response to Lord Jackson's review a number of years ago now into how the civil claims system is working. I think this whole area is one that government is keenly aware of, and to some extent it's always trying to play catch up, because of course once particular areas are overfished by the claims management companies, if you like, it's only then that government is able to take action to shut them down, and they move on, the claims farmers, to other areas. But it is an area that is constantly near the top of the pile in terms of focus for government attention more widely.
Okay, thank you very much. I think we'll have to stop there. As we've said, that the questions will be reviewed and utilised and responded to. And we did on the chat. We had somebody asking if the findings are applicable in Dubai. And whilst the data was taken from here, I think the lessons learned from the review can be used anywhere, in any location, about giving the right advice at the right time in the right format. So that's a good question to have. So I'd like to thank thank you very much, Jeremy and Richard, for your support, both not only today, but also in preparation for the webinar, and also thank our attendees. We had over 170 at one point. So that was really, really good. Thank you everybody for listening, and thank you for your feedback, and we hope to be in contact with more webinars soon. Thank you.